Welcome back. Now, earlier this year, the WHO declared that COVID was no longer a public health emergency of international concern. However, the virus is still being observed in some countries around the world, and Namibia is no exception. We're now joined by the Executive Director in the Ministry of Health and Social Services, Mr. Nangombe, to discuss with us the latest developments on COVID-19. Mr. Nangombe, good evening. Thank you so much for being here.
Good evening. How are you?
I'm good. How are you, sir?
Yeah, a bit down on your voice.
Just slightly, but we will recover.
All right.
To start with, I'd like for us to look at some statistics and, what are the current statistics on COVID around the country?
Yeah, no, thank you very much. I think you gave a very good intro to indicate the fact that on the 5th of May this year, the World Health Organization declared that COVID-19 is no longer a public health emergency of international concern. I think that speaks to the gains that have been made internationally and in individual countries in terms of combating the COVID-19 pandemic. And to this success, Namibia has also significantly contributed. But that does not mean that we are out of the woods yet, as the President has said on a number of occasions, because we are looking at and observing the trends in terms of infections that are happening locally, and we are doing so now, no longer issuing daily reports, but we are issuing weekly reports. So if you look at the period from the 5th to the 18th of June, we are talking about 176 cases that we have recorded as positive cases in different parts of the country. This is coming from the tests that were conducted, the laboratory tests of about 748, if I'm not mistaken, and this represents a positivity ratio of about 22.5%. But when you look at these statistics, you are seeing regional variations in terms of where the positivity ratios are high and the number of positive cases are being reported. For example, Commerce region, we are talking about 33% of the total cases. Oshana is about 24% of the total cases. So, and if you look at the positivity ratio of 22.5% over the period, this basically means that there are probably a number of more cases out there in the community that are not reported because there is now reluctance on the part of the public to get tested. And I think maybe I also just want to highlight that over this period of the 5th to the 18th of June, we have recorded about 3 COVID-19 deaths in the country.
Is the ministry concerned at this point, Mr. Nangombe?
You see, we are responsible for ensuring public health in the country. And in any event where we see that there are cases of a disease being reported, that causes concern for us. That is why we continue to observe what is happening. We continue to carry out the surveillance activities. We continue to carry out the testing activities, just so that we are also particularly able to locate and identify areas where we can find the clusters of cases so that we can deal with them accordingly.
What variant of COVID is currently being experienced?
We are carrying out what is known as the testing, the genomic sequencing tests. These are carried out by the laboratory at the University of Namibia and at NIP. So far, we are still only discovering that the circulating variant is the Omicron variant and its subvariants. And we are testing, of course, samples from all the positive cases that are reported. They are taken to the laboratory, genomic sequencing is conducted, and the circulating variants are still the Omicron and its subvariants. And should there be a new variant being recorded The public will be informed accordingly, and we will take the necessary steps to deal with that, including, of course, reporting this to the WHO and our international partners.
And what are the accompanying symptoms for the Omicron variant?
I think the Omicron variant is the symptoms of coughing, respiratory distress, and in extreme cases, you are talking about difficulty breathing, you're talking about altered states of consciousness, and really general body weakness. And this is what may lead to a person having to be hospitalized, and when they become really weak, probably having to be put on a ventilator or to be in an ICU setting.
Are there any precautionary measures that the ministry is looking to put in place at this point? We did see earlier in the program some reports from Katima Mulilo, some cases there of COVID-19 and deaths that have taken place as well. And the hospital took it upon themselves to reinstate, the wearing of masks and social distancing and other measures, etc. Is the ministry going to be, bringing back precautionary measures?
Yeah, having basically removed the stricter measures of COVID-19, we are continuing to urge the public to behave responsibly. We know exactly what needs to be done in terms of us being able to prevent new infections. So the whole question of, for example, ensuring that we avoid crowded places is very important. The importance of vaccination cannot be overemphasized. And the question of hand hygiene, for example, is very, very important, just so that we don't pick up these infections and bring it to our families or bring it within our communities. So I think Namibians are fairly well educated when it comes to awareness about COVID-19, and it's just important that we continue to live by those, particularly now that we are entering the winter season, and you know that respiratory illnesses such as COVID-19 tend to thrive in cold weather.
What has been, just for interest's sake, the uptake, with vaccinations during this, I guess what I would term quiet period?
Yeah, what I think needs to be emphasized is that the COVID-19 vaccines are available at our health centers and at our health facilities. So people are being encouraged to go and get vaccinated. We have seen a downward trend in terms of vaccine demand, but the vaccines are available, and we are encouraging people to get vaccinated because you never know how this thing is going to turn out. There could be new variants that may emerge, and as we have said and we continue to say, it's better to be prepared than to be caught unprepared. It's better to be armed than unarmed. So for that reason, we are encouraging the public to get vaccinated. Because the vaccines are there, government has spent money on this. It's resources that have been put at the disposal of the Namibian people to protect ourselves. And I think it's important that we continue to, people continue to get vaccinated in order to be protected better.
Mr. Nangombe, thank you so much for joining us tonight. Thank you for your time.
Thank you, Gina.
Well, on that note, we also come to the end of this evening's